Okay then, I know that we will have students kind of joining us over the next few minutes, and that's absolutely fine. But I do want to start, conscious of time and making the most out of the session today. And we promised a 5 p.m. start, so that's what we want to stick to. Thank you so much for joining us. It's amazing, proactivity after a day of school, making sure that you're here with us. We're continually impressed by your commitment to finding out a little bit more about careers, about what could be right for you and next steps. And I know we've actually done a number of these sessions recently, and commitment to coming back to the sessions is also really impressive. Don't worry, it won't be too much of me talking today, and we have experts who are going to be talking about the careers in primary care, not too much of me, but I will help you in this first instance in terms of how is it going to work today, and how can you get the most out of the session. In terms of communicating with us, then you can talk to us through the chat box. So Sharmella, that was absolutely on cue. Thanks for putting hello in the chat box. Can everyone else kind of just start engaging, just saying hello in the chat box, because it just makes us know that you're there and you're engaged and you're listening. Maria, hi. Ishmael, that's brilliant. Keep them coming. Join numbers as well, amazing that you're here again. Brilliant, keep them coming through. Victoria, Maisie, so good to see you here. And like I say, people will be joining us, and that's absolutely fine. So that's the chat box. On the other side, we do have the Q&A box, and if you have specific questions that you want answered throughout the session, then do try and direct them in the Q&A box rather than the chat. Seda, that's great that you've popped it in there, but in terms of questions, then just make sure that you do add them into the Q&A so that we don't lose them in the chat box with those comments, which are still great to see. In terms of raising your hand, you can do that as well. And if you have a particular burning question in the Q&A that you want me to unmute you for, that is possible. Just let us know. Let me know in the chat box any technical issues, and keep the Q&A, so those questions that we want to make sure that we get to at the end of the session today. In terms of who I am, I'm Ellie from Pathway CTM. So I work in the employer team, and I'm sure I might be a familiar face to some of you that have been on some of our events before. But really my role today is to make this as smooth as possible for you. So if you're having any technical issues, if you need any support, if you need everyone to talk a bit louder or a little bit slower, don't be too shy to ask, because really today's for you. It's not about us, speaking at a speed that we want to, or, we want to make sure that you are getting the most out of this session. So do kind of reach out to me privately or in the chat for everyone, and we can make sure that it is running as smoothly as possible for you and you're getting your questions answered. So as a test of that, I really want you to start putting in the chat box what comes first to mind when you think of primary care. There is no wrong answer. We just want to get you writing in the chat box, get you communicating with us, and some answers in there. So Sahiba's already put in there GPs. What a good quick response, amazing. I'm just going to kind of give that a second or so for some answers to come through. So do just put in there what comes to mind when you think of primary care. Day-to-day care, GP, pharmacy, well done, Najifa. Doctor, surgery, pharmacy, great, really good ideas. Just going to give you a second or so, and then we can make sure that everyone gets a chance. GP from Nicola. Marzana, first contact and principal point of continuing care for patients within a healthcare system, great. Olivia, GP, doctors, nurses, hospitals. Joinob, clinical for advice. Great. I'll just leave that on there for another second, and people can keep writing in the chat box. But that's what we want you to be doing today. Get involved, write comments, and make sure that this is a two-way conversation. So well done for all those students that have already put it in there. So Lamingso, emergency medicine, that's great. It's really good for us to know what comes to mind when you think of primary care. So well done, everyone that got back on that. So in terms of getting you engaged as well, I just want to launch a quick poll. This should pop up for you on your screen right now. So you will see that poll in front of you. All you have to do is click as multiple choice answer, and I can see those coming through. So keep writing in the chat box those ideas, but also keep an eye on this poll. And I know that I've spoken about the agenda on this slide, but really the agenda is going to be led by our experts who are joining us for this hour. So I will hand over in a second to those people, but I just want to make sure that I got some polls in for you first. So that is great. I can see about 60%, 70% now have done those polls, so I can share those with our speakers, which is brilliant. I'll just give it 1 minute or so, then I can read these out for you. Amazing. So I'm just going to end that poll, and I'm going to read out the questions we asked, and then also what our students have come back to us with. So thanks for getting involved in the chat box. The first question we asked was, what is your current understanding of routes into primary care? So 0% have told us that they have an excellent understanding of those routes in. So that's good, because hopefully today we can see some excellence coming out of the session. 43% have said good, so that's great. Our highest percentage was fair, so 54% told us they had a fair understanding, and then 4% said poor. So that's absolutely fine. That's why we're here today, and we're going to help you understand a little bit more. So thanks for answering that one. Secondly, we asked, do you know which educational pathway you're going to take next? So might be A-levels, might be BTECs, might be leaving school and starting an apprenticeship. 71% have an idea of what they want to do next. So that's great, amazing. And I'm sure we'll hear in the chat box some of those ideas over the session. 11% have said no idea, and that's absolutely fine. We can definitely help you. And then 18% have said, I don't know. So that's, again, absolutely fine. And hopefully today will help you with a little bit of an understanding of different routes people have taken in their own experiences. Thirdly, we just asked around if you are interested in going to a role in healthcare. Happily, I'm like 82% of people on the line have told us they are keen, and yes, you're definitely interested in a role in healthcare. 14% saying you don't know, which is absolutely fine. And then which year group are you in? So we've got the largest majority today is 71% year 12s, 11% year 13s, 14% year 11s, and 4% other. So that's really interesting. Thank you so much, everyone, for giving us those results, really. And it's nice to have you engaging and having you here. So like I said, this is not just going to be me talking for an hour, don't you worry. And I'm now going to hand over to Claire to do a bit of an introduction from your side.
Hi everyone, thank you Ellie. Yes, I just want to say a quick hello from me really. My name is Claire Wardle. I'm a nurse by background and I work for Health Education England, which is like the education and training arm of the NHS. And we've planned a number of events and insight events with Pathway CTM, and we've got more to come. So please do have a look at those forthcoming dates and hopefully you can join us. So I just wanted to thank you to Pathway CTM and thank you to colleagues for joining us this evening and giving up their time. Some are still at work. So, and hopefully you'll hear more about primary care. And it's great to see already some of our attendees have got a little bit of an idea of what primary care is. And it really does provide that essential sort of first point of contact in our healthcare system, really like our front door. So of the NHS. So it'd be great to hear more from the experts. So I'll hand over to them, but I just want to say a quick hello and welcome. So thank you.
Hi everybody, hope you can hear me okay. It's really nice to be here today, and I'm really happy that Claire asked me if I would come and do this and meet you all and tell you a little bit about primary care, because it's a bit of a passion of mine and the two other people that are here to speak today as well, Bala and Holly. So firstly, I thought maybe I should tell you a little bit about myself. So my name's Naomi. My official title is I'm the Primary and Community Care Nurse Workforce Lead, which is a very long title, but what that basically means is that I'm the lead nurse for primary and community care in some of the south of England. And I cover Berkshire, Buckinghamshire, Oxfordshire, some of Surrey and some of Hampshire. I've been a nurse since I was 18. I left home at 17 and went to nursing school. Followed a very traditional at the time route into nursing, and following my qualification I worked in a hospital. I did my general nurse training, and then after a while I trained again to be a children's nurse, which I absolutely loved. And I worked in many different places across the country, and eventually ended up as a sister on the children's ward at Wexham Park Hospital in Slough, which is my local general hospital. I then, after a while, got really interested in community and became a health visitor and moved into that community path, and that's where I've stayed ever since. And it's definitely where my passion lies. I spent much of my career helping others to look after themselves and keep themselves and their families well, which is a really big part of community nursing wherever you're based. Following this, I did a good number of years specialising in safeguarding, and was really fortunate to work across the UK and across Africa and Australasia, leading safeguarding services there. And now here I am at Health Education England, and I am now responsible for looking after the education of the nursing teams in primary and community care across my areas. For us at Health Education England and in the NHS, ongoing learning and education is really important for our staff. It means that we can ensure that all our nurses who are working in primary care are able to deliver top quality, safe care to our patients, and that's the most important thing. Today, I thought it would be really good to just a general approach around primary care, to actually have a little more look and build on what you already know, because some of you obviously know quite a lot already, and think about what other careers there are, apart from maybe the ones that you've already mentioned. There are many careers in primary care. Some are clinical and some are non-clinical. So let's have a look, shall we, and see what it's all about. Oh, my slide's not going to the next slide. Why is that happening? There we go. So I call this the primary care jigsaw. Primary care is a jigsaw made up of many different pieces, and everybody plays a really important part. Not one of these pieces will work without the other pieces. And you will probably recognise all of these, possibly, that you've already visited at some point in your life or your family's life. We often think general practice GPs are primary care, but you'll see from that that there are many different routes. Things like midwifery services, community nurses, dentists are primary care. So basically, as Claire said, primary care is your first point of contact with the health service. It could be the doctors, the dentists, the pharmacists, many, many others. And as you can see from this jigsaw, it's made up of a number of parts. It's worked that time. So where does primary care sit in our NHS service? So the NHS has 3 levels to it. The first one is primary care. We've just talked about that. GPs, general practice nurses, pharmacists, opticians, dentists, as we've already seen. Then secondary comes secondary care, and that is your hospital environment. So it might be the place that you went and had your tonsils taken out. It might have been where you had your appendix removed. And in more recent times in the pandemic, it's where most of our very poorly people with COVID have been looked after so very well. Tertiary care is a very small part, but a very important part of our health service. That's where people with really complex needs go to very specialised services. So it might be people with complex heart conditions or with specific cancers. So I don't know if anyone's from Oxford, but the John Radcliffe Hospital in Oxford is a regional unit with tertiary care. It's also a secondary care hospital, so it has a specialist part to it as well. I really like this visual. I've used it a lot. I used to teach nursing students and nursing associate students in a university. And I use this a lot to explain to them what is primary care and where does it sit and what really happens here. Holly used to be one of the students at the university I taught at, and you may or may not have seen this one, Holly. But basically this looks at where do people receive their health care. There is a misconception that all healthcare is delivered in hospitals. And you can see from this that actually the vast majority of healthcare is delivered in primary care. Now, that might be that you're poorly, it might be that you need help maintaining your health, but that's what primary healthcare is about. It's about meeting the needs of the vast majority of the population, the vast majority of the time. Often people think that if you want to be a nurse or doctor or a healthcare support worker, that you have to work in those hospital environments. But as I said already, only probably about 10% of the sickest patients are admitted to hospital. Everybody else is managed in primary care. Obviously, because of this, we need a lot of people to come and work here. We have a vast number of jobs, a vast number of different types of professions, whether, as I said previously, clinical or non-clinical, and it's a whole team environment that's providing this healthcare to the communities that we're in. I think the other thing about primary care, which I'm a health visitor by background, which is a public health specialist. So the other thing that's really important is it's not just about looking after poorly people. It's about helping people to look after themselves. And I've spent a lot of time helping families to look after their children well, to meet their children's needs. And that's a big part of primary care. We have a lot of preventative work going on. We have a lot of new roles happening in primary care, like social prescribers, who are there to help people to manage their needs, maybe smoking cessation, etc. So it isn't just about looking after poorly people, it's about looking after people in a whole way, in that holistically is the word that we would tend to use. So I'm going to take us back to our jigsaw. And because this jigsaw, I think, it just really represents everything that we're doing. Primary care is your first point of contact. You can see from the jigsaw that quite often there are lots of different bits in there. And just showing you this again will enable you to start thinking a little bit more about what primary care might involve. You'll see here that there are many places that you've visited already with your family, primary care, family, general practice, where your GP is, and that's what the place that most people seem familiar. And a lot of you mentioned the GP when Ellie asked you, what do you think about primary care? So just to labour the point a little bit more, if we put general practice in the centre of our primary care picture, that probably would be quite realistic, because they do tend to be the centre of the hub of all of things going on. They know their patients and they probably are sharing that information, certainly with places like care homes, nursing homes. When I trained to be a nurse, the people who are now looked after in nursing homes were the people I looked after in a hospital. Now hospitals have very sick patients, very specialised care. And actually a lot of the care that I learned to give as a nurse, as I said, are for those people who are now in nursing homes. And they are fabulous places to work because there's a lot of autonomy there and you get to know the community and the residents, and they're amazing places to work. But they will work with their GP surgeries, and the GP surgeries will provide a lot of the medical care for those nursing homes and those care homes. It might be that the community teams, the district nursing teams, are working alongside the general practice nurses in general practice to enable them to provide care for their patients. We've got community mental health services who work very closely with general practice. And of course, the pharmacist. You get a prescription, you go to the pharmacist. That is working together with your GP surgery. I think the one that's really interesting and is really only coming to light now is this purple hexagon that we've got on this diagram here. So if anyone's interested in working in police custody, health service, in prison service, all of that sits in primary care as well and is very much needed. I used to work alongside people providing healthcare for those who have been taken into custody, and they're usually in an amazing crisis in their life. So good quality healthcare for those people is really important. So who works in primary care and why do I think it's so special? And I think Bala and Holly are going to agree with me on this one, hopefully. So we talked about general practice being in the middle of the primary care team. Who would be working there? You can see a long list of different people that might be working there. Within each practice specifically, there'll be a number of different professionals and jobs. These range from the GP themselves, nursing team, to receptionists, administratives, financiers, people who are really good at finance. That's not me, by the way. Practice managers who run the whole practice, enabling the clinicians and other specialists to get on with their clinical work. Phlebotomists, people who take blood, an amazing skill to be able to do. Starting to move into primary care now are what allied health professional colleagues. So these are people such as paramedics, physiotherapists, and many other skill-based. And we are starting to work with our acute sectors to see how we can move these allied health professionals between the acute and primary care and see if everyone can get the benefit from that. As we've talked about previously, many people think primary care and general practice is about doctors and nurses, but there are many different roles that you can do, and you can see that from this slide. If you're interested in working with people and you feel that you've got something to offer, then primary care can definitely be for you. I mentioned and talked briefly about the fact that not all roles are clinical earlier on. Primary care is very much about teamwork. And there are many roles such as administrative and reception roles that are absolutely key to the running of a good primary care environment. There's also a new role coming in at the moment called a general practice assistant. They work and support the GPs. They're a bit like a personal assistant to the GPs. I think primary care is really special because you're working in a small team and providing care to all of the population, from the smallest of children and babies to our older population. You work in a community where you get to know your patients and can build up a relationship with them. They learn to trust you and you become an integral part of that community. Primary care is also very skills-based. This means that all of the team are highly skilled in clinical skills such as asthma and diabetes management, running clinics through video conferencing, immunization and vaccinations, minor surgery, as well as possessing great communication skills, because you couldn't do this job if you didn't have great communication skills. So moving on, could you work there? Is there something that might interest you? Now, looking at this slide, what you'll see is that there are a number of different routes that you could work in primary care. We've talked about non-clinical roles already, and these are just some of the examples of what a non-clinical role could look like. Receptionist, administration, general practice assistant, social prescribers are a relatively new role. I've got a link in the next slide where you can go onto Health Careers and have a look and see what a social prescriber is. I think it's an amazing job, and I would have loved to have done it actually. Care navigators are so important because they're able to point people in the right direction for the needs that they have. On the job development, now Bala will be able to tell you about this because he's very much done a career route of on the job development. But practice management, you might start working in a surgery as a receptionist or administrator and think, actually, I'd really like to get into the management of this, understand the finance, the people management, the HR side of things. So practice management is absolutely key part of running good general practice and primary care. Healthcare support workers, direct entry, you can apply for a job and be trained up on the job. Trainee nursing associates, you'll hear from Bala in a moment. That's what Bala's doing at the moment. That's an apprenticeship scheme. GPA roles, I mentioned that earlier, and nursing degree you can do as an apprenticeship as well. Then we move more into what I would call the more traditional clinical roles and the routes that people would take, the degree routes, and this is the route that Holly took. So Holly did her nursing degree. You might want to be a doctor, you might want to be a pharmacist, a nursing associate, there's a foundation degree, paramedic, physiotherapist, and many, many more. But there are many, there are so many options here that I think if you can't find one that might suit you, we probably need to help you a little bit more. So what next? So I've got a 17-year-old who's nearly 18, he's going to university next year. If he was you and he was looking in healthcare, what would I say to him? And that would be try and get some work experience, even if it's shadowing somebody for a while. Pop down to your local surgery, your local nursing home, to your pharmacist, to your community pharmacist, ask them, could I come and have a chat with you? Could you tell me what it's all about? What is it like? Have a look online. There are loads of career fairs that are being done virtually at the moment, but we also have Health Careers website, which is superb. And jobs, NHS jobs is a really good place to look for available jobs. Interestingly, also for primary care, your local paper is a really good place. Because it is a very local service for local people, they often will advertise in the local paper, especially for healthcare support workers or receptionists or administration jobs. And your local nursing homes will definitely advertise in the local papers. And then there is the training hub. So let me tell you a little bit more about the training hubs. Training hubs are the one-stop shop for all things learning and development in primary care. I work really closely with the training hubs all across my patches. They have their hands and fingers in the pies of all of the people that work in their areas. There are a lot of them across the southeast, and I've put all the links to all of the hubs in the next 2 slides. If I show you, that's the next one. I'll go back to this one. And they will be able to help you. They are also relatively new. We are developing primary care really hugely at the moment. So they would be able to help you, maybe point you in the right direction, give you some contact details. And I have warned all of them that I'm saying that today. So if you do decide to contact them, they should understand that, that where this has come from. So that's the end of my little spiel. I've just got one more thing to do, and that's to say thank you to you for listening to me. My email address is there. By all means, drop me a line. I'm really happy to help you in any way that I can. I know a lot of people in our area and across the southeast. So if I can point you in the right direction, I'd be really happy to. Just to give you an example of this, on Facebook, there was a chat going on about somebody who was a student nurse about to qualify and wanted to work in primary care and didn't know how to go about it. I ended up getting into a conversation with her. She was from the north of England, northeast, and I put her in touch with the training hub in that area, and she has now got 4 interviews for when she qualifies. So that's what we're here for. We're here to help you, and we're absolutely committed to your development and the next stage. So thank you very much.
That's amazing. Thank you so much, Naomi. And it's so great to kind of hear about the idea of having 4 interviews, especially at the moment. It's so nice to hear that positive news. I wonder, I guess it feeds quite nicely into doing a bit of an introduction of our other panelists and really like what your journeys have been. So Bala, just because you were the first mentioned in that presentation, would you mind giving us a little bit of an introduction, I guess, to who you are and how you've ended up where you are and what you do, really?
Sure. First of all, thank you so much for inviting me. But I can't believe it, 45 participants, amazing, I'm telling you honestly. And these people are actually on the right. They're on the right too. They know this is their guarantee job they will get, I'm telling you honestly. So actually, I'm working in the GP surgeries in East Berkshire. So interesting. So if you ask me the background, I work as a smoking advisor. I did my level 1 and level 2. Then after that, I work as a respiratory technician. Then I plan to work as a GP surgeries, primary care. So I did work 3 years as a healthcare assistant. So then my manager asked me, it's really wonderful opportunity she gave me. She asked me, do you want to do a nursing associate training program? So I thought, okay, let's see, I will decide and I'll tell you next day. The next day I will tell her, yes, okay, I will do it. So it is amazing. I'm telling you, it's an amazing course, 2 years, but it is intense. So, but you are going to learn so many things. So, and I feel this is my last year course. So I'm finishing December. So I'm feeling I'm a very accountable and very professional at the moment. So it is really good program, 2 years. And the second thing is I'm planning to do nursing career the future. So it is only because if you are doing the nursing associate program, they will give you 18 months for doing this nursing program. So it is very easy to come out there. Even you can develop, because as Naomi told, there's a lots of things you can develop your career after you're finishing your nursing, and you are very young guys, so you can very easily come in these different roles. You know, you can develop the primary care, and really helpful people. They will help you for develop your career. So if you need anything else, so you can ask me. So I'm happy to tell you more about the nursing associate program.
Yeah, no, that's absolutely brilliant. Thank you so much. Sounds like an interesting kind of pathway you've taken as well. I wonder, it sounded like you got to the nursing associate role after a little bit of work in healthcare. How did you first get on that ladder? What made you decide, oh, I'll start doing your initial role in the, sorry if I get the name wrong, around the kind of respiratory role? How did you enter healthcare initially?
So if you ask me my background, actually in my country, I'm a physician associate. So that will really, I thought I need to do something in my healthcare profession. I need to continue. So when you work as a HCA, I did more clinical things. They use my knowledge and everything. So then then I thought it's really good program for the develop my career. So in the future, so that is the things. There's nothing special, but because of my background of the healthcare profession, then it is easy for me to come in this program.
Brilliant, thank you so much. And I can already see a couple of questions coming in, which is brilliant from the students. But I wonder, Holly, are you with us? Great, perfect. No, that's great. Just to give us a bit of an introduction in terms of who you are, because I think I might field some questions to both of you afterwards. Do you mind telling us who you are and what you do and how you got there, I guess?
Sorry, one of my colleagues was just asking me a question about a patient. So my name's Holly. I work in a doctor's surgery over in Tilehurst. So I qualified September 2019, and I went to the University of West London, but thankfully I could go to the campus in Reading, so not much travel for me. Before that, so I did a year of A-levels, which I absolutely hated, could not stand it. So got through the exams, decided actually it's not for me, went to college. And so my options were to do a 1-year diploma in health and social care or do the extended diploma in health and social care. And at that point, I was undecided whether I wanted to go into nursing or midwifery. But the midwifery courses were harder to get into, so I decided to do the extended diploma so that I had more chance of getting onto one of the courses. So the extended diploma was 2 years. I finished that and then started at uni. So my first year at uni, I did just hospital placements, which again, I hated. I really didn't think that after my first year, I thought, no, this is it, I'm dropping out, I can't take it anymore. But thankfully, my second year, my first placement was in the community, which I absolutely loved. So I went with the community nurses and they were amazing. And I thought, yeah, this is definitely some sort of nursing I can do. Then I went on to do some placements in community hospitals, which weren't my favourite, but not as bad for me as the big hospitals. And then in my final year, I went and did the community pathway. So on the community pathway, you basically choose 2 placements, and then you choose your you ask for a final placement. You might not necessarily get it, but you hope for the best. And I did 5 weeks in the GP surgery that I'm at now, and then 5 weeks with the rapid response and treatment team, who are there basically to keep people out of hospital and in, they work in care homes, so they keep people in the homes rather than having to send them in. So they give IV drugs and can prescribe and give oxygen, and it was just amazing. And my final placement was supposed to be with the community nurses in Maidenhead, but luckily before that placement started, the surgery, Tilehurst Surgery, offered me to do my 12-week placement with them, which was amazing because I never ever in a million years thought that my first role as a nurse would be in a doctor's surgery. I always thought I would go into community nursing, I'd have to work my way up because it's an intense job because you're very autonomous, and I just thought, no, I'll never be able to do that. I'm not clever enough, I don't have the skills. But then I was actually offered a job at the surgery, so I was able to do a lot of my training that I would need for when I'd qualified during my final placement. So I did my 2-day immunisation training, my phlebotomy training, dressing, changing. So it was absolutely amazing. So then I didn't want to have a break after qualifying, so I finished my placement on the Wednesday, and then the following Monday I started as a nurse. So the transition was easy though, because I'd done placement during my placement. I'd been doing clinics, so it was pretty straightforward. And then so that was in the August that I started, and then in the September I started back at uni again, and they'd paid for me to do the general practice nurse course. So that gives you the basics, again, immunizations, basic asthma, COPD, diabetes, heart failure, smear training, ear syringing, the basics of what practice nurses do. And that was 6 months. And then after I finished that, I then went on to do, which I'm doing at the moment, an asthma and COPD course. So I had my exam for that on Friday, so touch wood, everything goes okay. I'm sure it will. So they've been really, really supportive. And now they've asked if I will do, so I'm going to be doing a minor illness course and advanced history taking and physical assessment, ready for when I do my prescribing.
Amazing. We've been busy over the last few years. Well, that's really interesting. And I wonder, lots of students might be sitting on the line thinking, oh, Holly sounded like she really didn't like that experience, but loved that one. How am I going to know which one's right for me? Is that the benefit of, I guess, doing the placements and things like that? How can you reassure people, I guess, that are on the line thinking, I don't know which one would be right for me? And how did you find it so well?
Yeah, so I had when I went into nursing, I had absolutely no idea what I wanted to do. And actually, I thought that after I'd qualified, I would go straight into working in a nursing home. That's because I'd worked in a nursing home before while I was at college. And I thought, yeah, that's what I'll do. I'll go into a nursing home. And I thought I would love hospital work, but you just get, as soon as you start, whether it's for you or whether it's not. For me, the deal breaker was I can't do 12-hour shifts. So I was like, no, I definitely can't do this. Can't do 12 hours, can't do nights. And I don't really want to have to do weekends if I don't have to. So that was, kind of the thing that really pushed me towards community. But also it's so personalized, and you really get to know your patients. And I have people phoning up now and they're like, oh no, I'll wait to see Holly, don't give me the next appointment, just put me with Holly. So it's really, really nice. The difficult thing is dealing with those placements that you really don't like, but thankfully the universities are really, really supportive. There's practice educators in the hospitals as well, so if you have any issues, you can always speak to them. And when you're on placements as well, if it's not something that you're enjoying, you have opportunities to go out and do different things with different people within the hospital. So I had a ward that I really didn't like to go to, so I went out and did it was a diabetic ward, so I was able to go out with the diabetic nurse and do about a week with her, just going to loads of different wards. So it was really nice, and I was able to, even though I didn't like the diabetic wards, I was able to see a different side of diabetes that I wasn't seeing on the ward. So it's really eye-opening, and the 10 to 12 weeks that you spend there goes really, really quickly. So even if you're not so keen on it, you just count down how many days you got left.
No, that's a very good point, and it gives you the varied experience, doesn't it, of course,
yeah.
Which is so important. And just one more question from me, and then I know that we do have questions in the chat, which I'm going to get to and ask the rest of the panelists, but part of your career journey then, of what you were talking about, there's so much development in you, and progression throughout that, and dedication from your teams to get you upskilled. Is that a big part of what you enjoy about the role, or are there lots of opportunities out there for young people on the line who might be really interested in that?
So there's so many opportunities out there at the moment. So I'm really lucky because they're actually funding newly qualified nurses at the moment to do something called the GPN fellowship. So basically, I work 40 hours a week, and so I do it across 4 days, and on 1 day a week I get half a day to go and do whatever CPD I have, so continuous professional development, so whether it be e-learning, or most of the time I use it for my asthma and COPD course, because that's kind of 4 hours that I can just do whatever I need to, revise what I need to, work on what I need to, so that's really handy, and that's available for all newly qualified practice nurses. And included in that course is also the basics GPN course. So the one that I went to uni for before is included in that course. So it's kind of, you know, once you've completed that, it's a 2-year course, but you kind of have, you know, so much skills under your belt. And even if, you know, you're in a small surgery and funding isn't always available, it's funded by the training hubs. So it's really great. And also we've been given some money to do whatever training we want. Basically, they sent us out a questionnaire and said, what would you like to do? And again, this came from the training hub. So there's no pressure from the surgery on deciding, you know, oh, well, you can't do that, you have to do this. They ask us what we want to do, and as long as, you know, the surgery are happy with us doing it, they fund us to do it, which is how I'm doing my minor illness and my advanced history taking, and also I'll be a student assessor as well. So it's absolutely amazing. There's so many opportunities out there, even from newly qualified.
Amazing. Yeah, no, thank you for giving us an idea as well of all those things that you're getting involved with. That's really helpful. So as promised, I'm going to ask some questions from the chat box. Marzana, some really good questions coming in from you. So well done. But I'm going to combine 2 of your questions, so I think that they work quite nicely together. So Marzana's asked, what's the most enjoyable and the hardest part of your job? So the flip side of that. And Naomi, I know that you've done various roles and you gave the background in terms of what you do, but I wonder if it'd be interesting to extend that to you and just see, yeah, what's your favourite part so far, and what have you found challenging, I guess?
Of this job specifically, or all of my nursing career?
Probably a very hard question, but I'd say all of your nursing career, actually.
So the best bit is always getting to know the people that you're looking after and the families, and understanding what they're going through and trying to help. None of us do this job for any other reason than we want to help people. If you made a stick of rock out of all of us, anybody in any profession in the NHS, you would have, we want to help people down the middle of us. It's what we're made of. So the flip side of that is always when it doesn't go as well as you want it to go. You know, even when things are really tough, you can make them nice or comfortable or respectful or dignified. It's when you can't manage to achieve the things that you would really love to achieve for that individual or that family. That's always the hardest bit. The hardest bit, sort of from a physical bit, is long shifts, sore legs, being busy. We're all busy all the time. Busy looks different for different professions in different ways. But that's why I particularly like working in teams, because the team, if you're working well together, will support each other with that. And that's the nice thing for me about general practice, primary care, all of that, is it tends to be small teams, but in a bigger arena, if that makes sense.
Yeah, no, such good points and such important messages for students that are looking to go into the career. So thank you. I wonder, Bala, I guess on a more recent day-to-day of what you do at the moment, could you say, I guess, what the challenges you find in doing the nursing associate role, and what are the good, you know, the best parts that you find about it as well, just to kind of extend that to you?
Actually, my interesting is long-term condition disease patients, especially because you can, at the moment, I'm doing diabetic clinic. It's really very good, interesting. But if you see, especially in East Berkshire, we have a communities while South Asian. So there's lots of diabetic patients. So that is really my interesting one, diabetes. Even Holly mentioned, sometimes we do interesting to the asthma clinics. Sometimes we are doing asthma reviews. And these are mainly my interesting long-term condition. So I think, which is the hardest part, I can tell you, maybe baby immunization, because I was sat with a practice nurse. I can't do it because it is really, but it is quite interesting. But I don't know, because the injection while baby is crying, so it is a little bit harder things. Time, sometimes, you know, anyway, if you come to a primary care, it's a very, very busy time. So that is the main thing. So because we are working as a PCN primary care network, So if you work one surgery, they will ask you to come in other surgeries, come and work, and they will ask another network group, come and ask. So that is, they make us busy. I'm a student as well. So sometimes the timekeeping is feeling harder part. So that is the main thing. Otherwise.
No, that's great. And it's really interesting to hear the kind of different interests of people doing similar roles as well, because it shows how diverse you can go down with all of the different roles that are on offer. Victoria's asked, Holly, one for you I might ask, which is, what A-levels would you recommend taking if someone's interested in taking a nursing degree? I know you took a slightly different route, but is there any, based on the fact that you're doing that at the moment, is there any recommendations on A-levels that you think might be helpful?
So each university has different requirements. When I applied, it was work. I'm not sure if it's still the same now, but it's worked on UCAS points, and there wasn't any specific A-levels that they required. However, the other universities, so I also applied for Oxford Brookes, and they required a biology A-level or equivalent. So the best thing to do would be to, you know, kind of decide what sort of university you'd like to go to. So if you want to move away or if you want to stay local, see what sort of, you know, experience the students offer, and what sort of rating they give, because that's more, that I think that's one of the most important things, is knowing that you're going to a university where you're going to be supported. And also, you know, in regards to doing what A-levels, just do whatever you're going to enjoy, because, you know, at the end of the day, you're doing a 2-year course with exams. If you don't enjoy it, you're probably not going to retain the information, and then it's an absolute nightmare when you have to revise. When I did mine, I did biology, psychology, chemistry, and maths. And biology and psychology I absolutely love. Chemistry, not so much, and maths I absolutely hated because I just could never remember anything, and I didn't enjoy it at GCSE level, but I thought, oh, you know, I don't know, you know, I might need it in the future, and I haven't. But, you know, just do whatever you enjoy, because that's the most important thing, and there's always other ways that you can go. You know, if you find that your A-levels haven't worked for you, you could go to college to do health and social care diploma, or you can do access to higher education. So there's always different ways. Just do whatever you enjoy.
Absolutely. And Naomi, is there anything you wanted to add on that one?
If I may, I think, was it Victoria? I think the other thing, Victoria, is that universities use something called a value-based interviewing. So what they're looking for is that people have the values of the NHS, that they have the values that would make a nurse, a pharmacist, a doctor. So if you go and look at the values of the NHS, that will give you some of the things that they're looking for. So they really, the academic side is important, but the fact that you have the values that you need to be a nurse is as important, if not more. And they will work with the qualifications, but it's quite hard to work with somebody who doesn't have the values, if that makes sense.
Yeah, absolutely. And also one question I just wanted to ask to you, Naomi, is that we've had a question in, or a couple of questions around the work experience. And I know earlier you helpfully gave us those links on the screen, which we can follow up with, around getting in touch with the training hubs. Are they similar? Would you approach a training hub for work experience, or would it be your local trust? What would your advice be on that side?
If you wanted to get work experience in primary care, I probably would go down to my local surgery and have a chat with them and see whether they would be willing for you to go and spend some time. The schools also have a lot of people that you can contact, so they have routes through to get experience. And you might find that it's easier for you to get work experience in somewhere like a community ward or a nursing home than it is in one of the big acute hospitals, especially at this time. I suspect you will struggle to get work experience in an acute hospital at this moment in time. I may be wrong there, but I'm just guessing that it's unlikely because of the pandemic. So I think I would probably use my roots at school. I would talk to my careers advisor or my sixth form mentor, if you have one, and say, do you have any links into healthcare? How do I do that? If you have a friendly local person in healthcare that you're interested in, go and have a chat with one of our local communities' daughter is coming to see me on Friday to have a chat about what she can do. So we don't mind that. We want the next generation coming through. So don't feel that you can't ask people. They will say if they can't do it. Obviously, there are a lot of guidelines around confidentiality, et cetera, so we have to work within that, and it has to be right for our patients. But most people would be willing to listen and talk to you.
Yeah, no, that's really, really good advice. And also one thing which is I think is worth mentioning is that every healthcare professional, I'm sure as well, understands that this year no one's been able to get physical work experience in surgery.
Yeah.
So there's no expectation that you should have that on your CV to apply to anything like that. So just to reassure students in this position, if anyone knows how difficult this last year has been, I think it's the healthcare profession. So don't worry too much and let it put you off applying that you haven't had that physical experience, because everyone understands. And being here today is in its way, it's its own work experience, it's its own expression of showing interest. So a couple of people have asked around the certificate for the event today. We'll definitely follow up with the information from the presentation and different snippets and what our speakers are comfortable with in terms of following up with today. So we'll make sure that after the event you get the information from the event today, and anything that you need on top of that or want on top of that, then we can kind of come back and forth with you from a Pathway CTM side to make sure you've got everything you feel you need after today. So don't worry about that, because I've seen a couple of questions come in about those practicalities. So that's great. And Seda said you did work experience with Bart's Health NHS last week. Amazing, congratulations.
Yes.
And what a great thing to kind of talk about in your applications in the future. So well done. And yeah, that's great to let us know. It's good to hear that things are going ahead. So thank you for letting us know.
Ellie,
yeah.
Can I just add in, so coming up, that South East Health Education England are going to be hosting a webinar on the 11th of May around the nursing associate role that BAL is undertaking. So if anyone is interested in hearing more about that foundation degree programme across the South East, they're very welcome to attend. So if we can pass the details on to you to share, would that be okay?
Yeah, absolutely. We can put that in the follow up from today and make sure that everyone has access to that.
Thank you.
Yes, no problem at all. So I know that these sessions just fly by, don't they? The minute you started them, then you feel like so much time has gone past. But students, do you get any last questions you want in? Well, perfect timing, Grace. I can already see a question coming from you. I'm going to ask that one to Naomi. So can you just tell us a reminder from that presentation earlier about what are the training hubs and how they're important?
It's a really good question, Grace, because training hubs are relatively new. They've only been around for the last 4 to 5 years and are still developing. If you work in an acute hospital, there will be a team there who will look after the students and the learning of the staff members on the wards. In primary care, we've never really had that because each GP surgery is an independent surgery. And so sometimes people didn't get the training opportunities or the development opportunities that the acute sector and the hospitals got. So the NHS recognised that Health Education England and NHS England have worked together to develop something called a training hub. And they are actually the construct, it's a really weird word that, but they're sort of like the long arm of Health Education England. And through them, we work with people like Holly. So Holly mentioned the training hub, funded her fundamentals course and her GPN fellowship. That comes from me through the training hubs to Holly. And those training hubs basically are like the conduit, they flow everything through. So we might recognise that there's a need for something, or something might come down from government to say we need to develop some. So we've had something called the GPN 10-point plan for the last number of years. I can't remember the number of years, 5 years. And that's come from government, and we've had to implement that. So a lot of what Holly has experienced and Bala is experiencing is because of that government directive. So we work through the training hubs to deliver that to Holly and Bala and their colleagues. Does that make sense? They are very new even to us. So I'm not surprised you've never heard of them, but they are like a one-stop shop. And they will get more and more mature as time goes on. But we also have learning environment leads in them. So they're there to support the students in placement, they're to open up placement. So if you're a student nurse, you can get more. My ambition at the moment is if you remember that triangle that I showed you earlier on, at the moment, our student nurses do predominantly most of their training in the acute hospitals and only a very small amount in primary care. It doesn't match the provision of healthcare at all. So my dream and ambition, and it will happen, is that we flip that the other way around so that we get at least 50-50. 50 in the acute sector, 50 in primary and community care. Because there are people like Holly and Bala and myself who are community workers. We found our feet when we arrived here. And you will, when you get your experience, you will find your feet as well. But you do have to experience everything to know where you want to be.
Yeah, no, absolutely. Thanks for clarifying. And Grace has put in the chat box. Thank you so much for clarifying what it meant. So obviously, that's great response. Thanks, Grace, and great question. So conscious of time, what I want to just do is kind of end on a question, which is, and Claire, I know this is difficult for you because I've asked you it quite frequently. But in terms of if you had one piece of advice, and I guess Holly and Bala and Amy, particularly from your healthcare and primary care experience, what would your one kind of takeaway be, looking back on the experiences that you've had, that would have been really nice to know if you were kind of 16, 17, 18? Could you think of anything that you would share? So maybe Holly, starting with you.
So the one thing I would share is to just be confident and smile a lot. Smiling is really great, and it makes you so much more approachable. And also, before I was offered the job here, I literally emailed every single surgery to see, and even if there's a nursing job and you think, oh, I don't know, you see it and you think I could never do that, like I did with working in primary care. It's so doable, and people are so willing to train people up. And if you do go down the nursing route and you see a job and you think I'm really underqualified, but that's a job I'd love to do, just email them. Informal visits are the key to getting jobs. I think if somebody if we had 2 applications for a job and one of them had come to visit the surgery and come for an informal visit and the other one hadn't, the one who had already come, that's already a tick in their book. But if you think you're underqualified, even if you're underqualified, just go and speak to them anyway, because I've done that and it works apparently.
That's amazing. Yeah, I think it's definitely the way of life, isn't it, sometimes? So that's really good advice. Bala, is there anything you'd add from your experiences?
Yes, I'm telling honestly, because I have a second language, English. So don't worry about it, because when I start this course, my university, they're really helpful. They're helping for anything. For example, if you ask them, even they're helping for the English language test and the maths test, everything. So that don't worry about these kind of requirements. So you don't have this, I don't have this. So just come and ask. You can even go a local GP surgery, so you can find out these kind of nursing course associated or anything course. So definitely they will help you. And there's so many ways we can help you if you come under primary care. So for example, Naomi, like this PCN primary care network, so you can develop your career plan. So this is really good starting for the people who are coming healthcare profession. So this is really very good.
Yeah, such a good point. And I'm sure lots of our students on the line might be in the same position as well, where English isn't their first language as well. So that's really reassuring to hear. Naomi, I saw you nodding in agreement at one of the questions that came in, and also if there's anything else you'd add on that point, I guess.
I think just one step at a time. You're never going to know where you're going to end up working, because you'll start on your journey. And I never planned to be a children's nurse. That led me to be a health visitor. Never planned to work in safeguarding. I never planned to be in education and to teach. And that's the joy of a career. It develops. It doesn't have to be mapped out. Take the opportunities, get to know people. networking is the most important thing that you can do, but in a really honest way. So just one step at a time, just look at the next step.
Yeah, and that almost makes it less daunting in a way, because I think sometimes you see panels of such amazing people like yourselves and you think, oh, I don't know if I have the experience or things to do there, but all of us have just figured it out, I guess, one step at a time. So really good advice.
One step, you only have to be 5 minutes ahead of yourself, that's all.
Yeah, exactly. And Claire, thank you so much for organising and facilitating everything. You know, it's been brilliant, and yeah, thank you so much. I wonder if there's anything else from your side.
No, just to thank everyone really, and I think what came out of everyone's discussion is that crucial thing about building up patients' relationships, and you know, patients gaining your you know, their trust. And I think that's really key, working in healthcare, the teamwork and looking after, I suppose the focus is more about that health and well-being, and as Naomi mentioned, it giving people those tools hopefully to help and care for themselves and their families. But no, I think it's been so interesting. So yeah, thank you to colleagues really. And I suppose a point to build on that colleagues have said is to have that open mind. I think that's really crucial. No, don't have any set ideas of what you're going to do, and just be open and receptive to those learning opportunities, and don't give up. Sometimes people can take a few knockbacks if work experience isn't offered in a particular area, but try another routes. Speak to as many people as you can, that Naomi mentioned about the networking. So yeah, so don't give up, and good luck in your chosen career.
Yeah, definitely. And that leads on really nicely to kind of the next step from a Pathway CTM side, and in terms of us helping follow on from today. And what I've just done is pop a quick type form survey in the chat box. So if possible, please everyone do take a couple of minutes to fill out that survey. I promise you it takes less than 2 minutes. I've done it myself. So just make sure that you do fill that out and let us know what you've enjoyed, what you would like to see more of, what you are interested in doing, and arranging that follow-up call with our mentorship team to make sure that we can help you with those next steps in terms of helping you get to where you want to be, and maybe sitting on one of these panels in a few years' time and telling everyone about your journey. So do just take the couple of minutes to get the most out today, and we will follow up with everyone. I will make sure that we kind of send through the details around that event on the 11th of May, like mentioned, the links from the PowerPoint presentation to make sure that you have those and access to those, and any of your email addresses where appropriate, and follow up with, yeah, really that information from today. But thanks again for joining us this evening. We're so impressed. You are the type of people that will end up being successful whichever path you take, the fact that you're here tonight. So enjoy the rest of your evening. Have a stretch of the legs and a glass of water. I definitely need to. So have a lovely evening, everyone, and I'll stick on the line for a few minutes just to make sure that you have access to those that survey. And thanks everyone, particularly asking today. And yeah, have a lovely evening.
Thank you, Ellie. Bye-bye.
Thank you.
Thank you. Bye.